Everyone, Mohammed here from Dr. Yusuf Clinic. I want to spend a little time to talk to you about our weight loss service. So this is a holistic service where we combine lifestyle interventions, fitness advice, habits advice with medication to look at maximizing weight loss for you and hopefully keeping that weight off in the long term. So I'll go through the medication a little bit for you to go over the expectations, how it works, and hopefully answer some questions that you may have. So the medication we use is called a GLP-1 agonist. Without going into too much detail, GLP-1 is a hormone that's naturally secreted when we eat food. It has a number of functions in the body. One of the key functions is to tell our brains that we've got something in our stomachs. So what that does is tell our brains that we probably shouldn't be hungry and we should start to feel full. And it also slows down how quickly our stomachs empty food. So when you think about weight loss, fantastic, because we're telling our bodies that we've got food when potentially we don't have it, and that reduction in appetite means we eat less, and that increased satiety means we feel fuller and quicker as well. So the medication itself is an injection. It's a weekly injection, and we start off on a low dose and increase it gradually over a period of weeks until we get to the maximum dose, which hopefully gives the maximum effect for appetite suppression and increased satiety. So there's a couple of things that come with that. So the medication itself, patients have to be suitable. There are certain patient groups that can't have it, which include people who are pregnant, people who are breastfeeding, people with a certain history of cancers, and also people who don't meet the BMI criteria. So for the weight loss service, we are looking for patients with a BMI of at least 27 or above. And if you're not sure what your BMI is, there's plenty of calculators online. So if you type in BMI calculator, all you need is your weight and your height, and it will work that out for you. The reason being, anything less than 27 isn't really considered overweight in the sense of the medication wouldn't be recommended in that group. If you have any doubts or you're not quite sure whether you meet the criteria, we can have a discussion, and please contact, and we'll go over your specific needs. So the medication itself also comes with potentially some side effects, the main one being nausea, and that's why we start off at a low dose and increase gradually. And the idea of doing that is we reduce the effects of that nausea, and you get your body used to the medication. So we don't start off with the treatment dose, we start off with a dose that's much lower. And as I say, we build up, and it depends on the individual, on yourself, as to whether or not you tolerate that really well. Great, and we'll keep increasing it, or not, and we might stay at a lower dose for a little bit longer and increase it as you get more used to it. Other side effects, potentially pancreatitis is one of them, which is a pain in the stomach area. Very rare side effect, but something I need to discuss with all patients as well. So on the whole, it's quite a well-tolerated medication. There aren't a huge number of problems with it, and compared to a lot of other weight loss interventions, it's considered one of the safer options out there. So what I would do with the service is combine the use of treatment with those other things I discussed. So we look at your lifestyle, we look at your history, what led up to you potentially being not at a weight that you'd like to stay at, what factors into that, how you pick your foods, and kind of peel all that back and think, well, what can we do to support you to be able to maintain, or not only lose the weight, but keep it off in the long term? Because we don't want to stay on this medication forever. We want to be able to get a real grip of our weight, and hopefully use this as an opportunity to keep the weight off and be healthy in the long term. So if you have any questions, please get in touch with the clinic. We'll go over everything. We'll set up a consultation with myself, and I'll spend a lot of time looking at your medical history. I'll get you to fill in some forms, and we'll really delve deep into it and see, what's the best approach for you. And as I say, we're going to combine everything to get what you need out of the service. Thank you, everyone, and hope to hear from you soon.